One of the things that I want to bring up is in relation to TAPS, a frightening statistic that I hear quite a bit, and it actually comes out of the TAPS registry itself, and that is that more than 50% of TAPS cases are discovered after birth. And to me, this is quite shocking because, with routine monitoring, we can actually find these cases before birth. But in this case, I'd like to introduce Vicky again, Vicky Norbury, and ask her to talk about her story and to tell us a little bit more about the importance of monitoring, because I know things didn't go quite to plan in your case. So yeah, Vicky, take it away. Tell us about you, your story.
So we had what was classed as a textbook pregnancy. We had scans. Scans came and went, and we were told everything is absolutely fine. Um, we didn't necessarily know the detail of what should have been monitored and what shouldn't have been monitored at the time. And we just accepted that the right things were being done. After delivery, our recipient twin was very red. Our donor twin was very pale, and was struggling. She was in distress during labour, and she was struggling after birth. It became very clear at that moment that there was potentially TAPS involved. We didn't have our fluid levels checked. We didn't have MTA Dopplers. We had nothing other than size checks throughout pregnancy. And after delivery, there wasn't really any checks done after delivery other than hemoglobin, and general post-birth bloods. So even there was nothing. There was no checks done that could have identified it afterwards or could have identified it during pregnancy.
And yeah, you said that you had no routine checks done, and after birth they just checked the hemoglobin levels. And we do know that with a TAPS diagnosis, you must check the hemoglobin and the reticulocyte levels in the blood of both babies. And the diagnostic criteria are available on our website, but they're also available online in many places. But I guess this kind of leads into what was the outcome for your girls, Vicky? And take your time answering this because I know it's a rather touchy subject.
We lost our donor baby, passed away at 2 days old. She never. It's hard to put the right words in. She was just kind of treated as. It was treated more as a birth injury than anything else. And so, yeah, we lost her at 2 days old. Our recipient, he's well. Hard work, but well. But we don't, even now with her, we don't get any of the follow-ups that we should have because she's not treated as a twin. She's just treated as a premature baby.
And that does make it quite challenging because we know that even uncomplicated twins have a chance of some degree of neurodevelopmental impairment. But with TAPS twins, we know that this is quite high, and we'll probably talk about that a little bit later as well. But I guess for me, Vicky, one of the things I want to know is what have been the challenges that, other than, of course, having your daughter identified as a singleton who was premature rather than a twin, what other challenges did you encounter during the post stage of birth and between and to now?
It's never ending. I mean, some of it is, I want to say minor, but it's not minor from our point of view. So quite often we will go to appointments and they'll say, "Oh, it's Sophia, twin one," but then she's treated as a singleton. And also follow-up appointments, people will quite often say, "Oh, twin one, where's twin two?" There's no continuation of any follow-up. So when I'm trying to get help with her for things that she's showing as a struggle, which could be linked to being a twin, they immediately ask where the other twin is. And when I can't show her, they will not then treat her. They will not then look for the things linked to the twin pregnancy because the twin isn't there.
And not having an official diagnosis put on her records, has that been quite a challenge as well? Or
yeah, because a lot of it is me saying, but they potentially have this, and a side effect of TAPS could be this, and this. And although, yes, we haven't got the diagnosis, I always argue that there's no harm in looking anyway. If there is the potential that was there, why are we not now looking in case the side effects are there, just in case?
Yeah. And because I know that through your story, because we've known each other for quite a few years now, know through your story that you were actually labelled as acute TTTS rather than TAPS because there was the appropriate testing wasn't done. Have you had challenges from having that listing as acute TTTS over TAPS?
That's not on any of the records. It's only on Olivia's coroner report.
Wow. Okay.
So the actual... Sofia has nothing on her records at all, except for twin delivery, twin 2 deceased. That's it. That's all we've got.
Oh. All right. So I guess my big question to you, because one of the things that we are talking about during TAPS Day this year is educating professionals and other parents about TAPS and what they need to know. What would be your need to knows for medical professionals to start with?
First of all, I'm really... Oh, sorry, Vicky. Especially Vicky, I think, is it not me? Okay, please.
I'll ask you in a moment, Vid.
No, I mean, I'm really, I think I'm really grateful to Vicky actually for sharing her story. It must be very difficult to actually go through that and talk to us about it. So really grateful that you share your story. Really powerful, and I think powerful lesson for everyone listening to you, particular healthcare professionals, how we could improve the way we practice so that, hopefully you would have had an outcome.
Yeah. I think that's the key, really. And that's something that I will always say now. If we get mums, parents coming in and saying, my wife, me, we're struggling, this is happening and we don't know what we need to do, I always tell them to be insistent that the monitoring is done, because I know NICE, for example, will say we're not going to check for that until there is indication of that. Well, if you're not checking for it, you're not going to get the indication of it. So how can you possibly catch that indication of the being TAPS without you checking for TAPS in the first place? So I always try and get people to push for the MCAs, which can be a battle, as we know, and some centres just don't know how. There is a lot of centres around locally that just do not know how to do MCA Dopplers.
And I think that's also one of the problems with screening, as well as introducing screening protocols, is the fact that it does take a lot of money to train staff. It does take a lot of time to train staff. And there is also a little bit of stubbornness, I think, about wanting to change and wanting to embrace a newer way of doing things. But yeah, it's so important that we do raise awareness that TAPS doesn't have physical symptoms like TTTS, because we all know that when we had told with a twin pregnancy that, okay, you need to be looking for the signs of TTTS. Do you feel bigger? Are you feeling heavier? Is your belly really tight? These can be indications of TTTS, but with TAPS, we have no external symptoms. And as Vicky quite rightly raised, if you're not looking for something, you can't find it.
Yeah, you're right. And Matt, also, I think it raises really an interesting dilemma that we have in this. We want everything we do to be based on evidence, and that we have really good quality studies that support our practice. And I think this is really challenging when it comes to twin and multiple pregnancies, because, we don't necessarily, often we don't have many studies. Often the studies with even big trials where some majority of them would exclude twin and multi-pregnancy. And therefore you almost need investment and need focused efforts on actually how we improve our ability to drive the research into a multi-pregnancy, but also the fact that when we are developing our protocols or our guidelines, that despite the fact, yes, we want to have this highest level of evidence to support our recommendations, there is just the fact we don't have them. And sometimes the absence of evidence does not mean that we should not be doing it.
Yes.
But as I said, that's just my personal view. I share your frustration.
It's a view that I also share, because I think it's quite a paradox, is that there isn't enough evidence, but if you're not looking for it, you can't create evidence.
And therefore, I think it's an opportunity really to call for all the key stakeholders, any professional body, or the government who could sort of listen to this conversation and say, we really want to have more research focused on twins and multi-pregnancies, but also for any guideline or organizations or committees to actually highlight the fact that there will be, particularly in twin multi-pregnancies, where we don't necessarily have this level 1 evidence to support every recommendation, and for the healthcare professionals to be really motivated listening to your story. And I'm confident that every doctor and midwife wake up in the morning and they want to go to work and do their best for the patients. I have no doubt in that. But how we can actually motivate ourselves to drive our practice, to want to do better, and to want to actually not saying, well, I can only do that when it is recommended, because, not looking for a problem in the pregnancy, or not knowing how to look for a problem in pregnancy, it sometimes can result in poor outcome, or losing babies, or losing twins, like Vicky's case, which is quite sad, of course.
That's exactly it. So Vicky, thank you so much for sharing that part of the story with us. But also, I think what's really important is also what you want parents to know, and the parents and the general public to know in relation to your story. What do you think that is the most important thing they can take away, and what do you want them to know?
I think the most important thing is advocating for yourself and for your babies. Even if you think, well, that's a doctor that said that, so therefore it must be right. No, you not necessarily. You have the right to challenge that. You have the right to go to somewhere else and get that second opinion from somewhere else. And I think that's the most important thing, because many places will tell these parents that they can't. Well, we are the best. We are the same level as them, and equivalent things. And I think it's important that they know that they can go to somebody else and they can get that further opinion and insist on the different treatments and tests available.
I agree with you, Vicky. I think patients should be entitled to ask for a second opinion. I think it's also difficult, for obviously sonographers and healthcare professionals, because they follow protocols and guidelines. So, it's difficult to, and it's always easy to look backward. And it is true that obviously our understanding of TAPS and our ability to monitor and diagnose, and even, what management options, and even the trials or studies, they're all relatively new. You're talking about 15 years. That's not a long duration sort of history of medicine. So, and how things progress slowly. So despite the fact I fully endorse and agree with you that you should be able to advocate for your self and for your babies and for your pregnancy, and you are entitled to, of course, ask for a second opinion. I also sympathize with the healthcare professionals on the show floor, because they just follow the protocols and the guidelines. And I hope that I demonstrated to you that even when guideline committees, they they really want to, but I think they have a process that they go through, and it's difficult to, even if you disagree with the conclusion, I think it's important that you understand why they made this conclusion and how we can, we can always sort of trying to push the boundaries, because we know that by pushing the boundaries, hopefully will improve the outcomes. It's just the fact that we don't really have the strong evidence to support that.
Yeah. And I think what's also important to realize too is that guidelines are just that, they're a guideline. You can always go above and beyond what a guideline says. Because routine MCA aren't always suggested, it doesn't mean you can't do them. You can absolutely do them. And I think that's a really important thing to just emphasize at this point, is that just because a guideline says it's not necessary doesn't mean you shouldn't do it. You can. Give that extra level, take it to the next step.
Yeah, and in the hospitals where I work, we do obviously monitor all monoclonic twin pregnancies for TAPS using the MCA Doppler. So you're right. I think in your own practice, you can always look at various guidelines, understand the variation, and make your own decision about what you want to implement.
Yeah, and this is a trend that I've noticed too, and not only in the UK, but also in the US, that a lot of doctors, because the US guidelines also don't support routine screening, depending on which organization you look at, because one organization strongly recommends and two others don't. However, it's one of those things that no one ever meets in the middle until they have to. But a lot of independent MFMs and a lot of hospitals are introducing them as routine anyway. So it's a really good to see that people are, even without the support from guidelines, are still taking on the challenge of stepping up and introducing it as part of their care process regardless. So it's good to see. It is slowly evolving, slowly, but it's happening.
Maybe as I mentioned, we just really should use the opportunity with a whole week of focusing on TAPS and raising awareness, and to actually call for more research studies and for guideline committees to relook at the evidence, because if it's let's say for NICE, they looked at it back in 2019. Well, we are in 2024. And there's obviously a number of studies that's been published since, looking at the accuracy of the ultrasound and also looking at the outcomes, and sort of they're also looking at the outcomes based on the management option with all the data from the registry and hopefully from the TAPS trial. So perhaps maybe it's time to reconsider, reevaluate the evidence, and really examine the recommendation and see whether it's time to maybe amend them or change them.